Hi, this is Dr. Bob Dannenhoffer. I'm the Public Health Officer for Douglas County, and today we're going to do COVID conversations, and we have more. Kristen Watson, who's one of the health promotion specialists here in Douglas County, is going to be joining us to talk about something which I find to be incredibly exciting in medicine, and that is the first vaccine we have that helps to prevent cancer. So let's start with COVID, and COVID is still with us. When we look at the world level, there's still lots of disease of COVID in Australia, New Zealand, and Europe. And we do really not know what's going on in China. They're having a lot of lockdowns. They say not very many cases and not very many deaths, but it's really hard to know what's going on in China. As you know, they've had very little disease reportedly during the pandemic, and they've used the Chinese vaccine, which does not prevent well against Omicron. So they're really at risk for having huge outbreaks. And I think they're still working with lockdowns. But the rest of the world is actually pretty quiet at this time, and we're seeing a declining number of cases in the world. In the US, we're starting to see a slight increase in the number of cases, but the increase is small and very small in comparison to what we saw during Omicron or what we saw during Delta. And the good news is that during this surge, if people are vaccinated, and especially if they're boosted, they're very well protected against severe disease and hospitalization. So you may have noticed that back in DC, many of our elected leaders have been infected, including the Vice President, Speaker of the House, Senator Wyden, Representative DeFazio, have all been infected. But because they were all vaccinated and boosted, they've all had mild illness, and you've not heard of any hospitalizations or severe illness among legislators. So I think what it shows you is that it really does work. Oregon is seeing a slight increase in the number of cases. Those cases are almost all due to this BA2 variant. They're mostly in the Portland area, a little bit in the Corvallis area, and in Bend. However, still quite quiet in Douglas County. The number of hospitalizations in the state is slightly rising to the mid-hundreds, but that's still much, much lower than the over 1,000 number we had with either Delta or Omicron. When we look at the predictions, what we're seeing is we're seeing that we expect to have a bit of a spike, maybe 10 or 20 or 30 cases a day here in Douglas County. That'll last a month or so, and then it would go down. And this is all dependent upon whether there's any new or nasty variants out there. And as I say, there's always new variants being created. But most of these are going to be nonsense, and they're going to go away, and nothing's going to happen. But occasionally what you'll find is one of these variants that can either escape the vaccine, or one of these variants which is much more serious, and then that could take over. So we're still really, really, really needing to watch the variants in the world to see if there's anything new or big coming. You'll remember with Omicron, we looked like we didn't know at all about Omicron, and then within the space of just a few weeks, it had taken over the world. So we still need to monitor that, but things are going well. The biggest news is that the vaccine really does seem to work. When we looked at our last 40 deaths, only one of those 40 had been up to date on their vaccines. In the last 2 weeks in the hospital, we've not had a single person in the hospital who's up to date on their vaccines. So the vaccine doesn't necessarily prevent the disease. Vaccinated people get the disease, like the Vice President and the Speaker of the House, but they tend not to get very sick and not need to get hospitalized. I know a bunch of friends who've gotten it, even though they've been vaccinated, and the ones who've been vaccinated said it's really been pretty mild. So please get vaccinated. Please stay up to date. If you do happen to get it, we've been hearing that many of the people back in DC have been treated with Paxlovid or one of the other antiviral drugs. We also really recommend that if you do get it and are positive in a high-risk group, please get Paxlovid or one of the other treatments, because it really could reduce your risk of hospitalizations. At this point, our goal should be we should never have another hospitalization from COVID. And I think we're at a point now where we could do that. Can't get rid of COVID. I don't think anybody's going to suggest it's going to go away totally, because there's so many reservoirs of COVID among populations in other countries, among other animal populations. So this idea that there'll be a time where it'll be totally gone is, I think, pretty unlikely. But I think given where we are now, we could have a goal of having no future hospitalizations and no future deaths from COVID. However, sadly, we had a death this week in a young person who was not vaccinated, got a bad disease, and wound up dying. So really, 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 it's time for us to get up to date on our vaccines and to get vaccinated. Few interesting and new things this week. The FDA has approved a breath test, believe it or not, a breath test for COVID. That's not going to be available for a while, but it's kind of an interesting new way that we're looking at disease. And there's been a lot of talk this week about the Pediatric Vaccine, and that is a vaccine for kids 6 months to 4 years. The sad news on this is for the last 6 months now, we've been hearing the same stuff like, oh, it's just around the corner. And then you turn the corner and it's really not there. So I'm only going to believe the pediatric stuff when I see it. Again, the disease is not very serious in those kids 6 months to 5 years. We've only had a couple of cases, just a few hospitalizations. Really, the goal should be to really beef up our immunizations among people my age, because people my age are the ones who get it. We get sick, we spread it to others, and when we get sick, we can get hospitalized and die. So please, if you're not up to date on your vaccines, please go ahead and get it. The other question was about the second booster. And the second booster does give some added protection. I got a second booster, but the additional booster, the second booster, gives it just a slight rise in protection. And so we're recommending that for people with the highest risk, that is people who are 50 and above, or people with underlying conditions. I got it. When people say, well, what, should you get 100 of these? And the answer is, well, you have to do the risk-benefit analysis. And the way I look at this is if you were a town in the middle of nowhere, didn't have a fire department, didn't have a firehouse, it would be bad. House would burn down. It would be terrible. So you'd build a firehouse, and that would give you some protection. And people say, well, wouldn't we get more protection if we had a second firehouse on the east side of town? And so you build a second firehouse on the east side of town. And at some point, building more firehouses doesn't really provide you that much more protection. Similarly, with vaccines, you get your most protection from the first part of the series. You get this next most protection from the first booster, and then you get other protection from the second and other booster. So if you're at high risk, please get your second booster. If you're at lower risk and a young person like Kristen, you probably can hold off on that second booster for a while. So let me introduce Kristen. So Kristen works with us, and she does lots of things. But one of the things she's working on is HPV, or Human Papillomavirus. So Human Papillomavirus is a virus which is common, circulates among people, and is the leading cause of cervical cancer and anal cancer and oropharyngeal cancer. And the great news now is that we have a vaccine which is incredibly effective at preventing this disease. So Kristen, welcome.
Thank you so much. Yes. So HPV, or human papillomavirus, is a family of viruses that can infect the skin and mucous membranes. And mucous membranes are those wet, slippery linings within parts of our body. And HPV is spread through intimate skin-to-skin contact. It's one of the more common viruses spread this way. It's estimated that 80% of adults, sexually active adults in the United States, will contract one type of HPV during their lifetime. And since it is a family of viruses, there are several different types of HPV, and they're typically split into two main categories. There's one category of HPV types that can cause genital warts, and then there's a separate type that can actually cause cancer. And even within that group, they're split into two types of the lower risk and the higher risk types of HPV. There are about 13 million new cases of HPV among adults and teenagers in the United States every year. And while that seems like a pretty high number, the good news is that about 9 out of 10 of those HPV infections are taken care of by our body's immune system, by our natural defenses, and they're able to clear that virus out in about 2 years. And you might not even know that you had that infection. You might not see any signs or symptoms. Where we start to be a little bit more concerned is when that virus, that infection, sticks around longer. When it can stick around and linger in our cells, it can actually change normal cells into abnormal cells or precancers. Like you mentioned, HPV is the #1 cause of cervical cancer in women. About 10% of women that develop an HPV infection in their cervix will not be able to clear that through their body's natural defenses in a timely manner, and it can actually lead to cervical cancer. HPV can also cause cancers in other places, so penile, vaginal, vulvar cancers, anal cancers, and oropharyngeal cancers in male and females. The oropharynx is that area in the back of your throat with your base of your tongue and your tonsils. And there are about 36,000 cases of cancer caused by HPV just in the United States every year. And while that's concerning, the truly remarkable news that we have is that 90% of those cancers can be prevented through vaccination. So when they learned that HPV was the main cause of cervical cancer, they started working on a vaccine for it. And they started developing that vaccine in the 1980s and 1990s. And they were able to create a vaccine from one small little piece of that virus, so just one small protein. And so when you receive the vaccine, it's not infectious. It cannot give you an HPV infection and it cannot cause cancer, which is really great. They started developing the vaccine in the 1980s, 1990s, but it actually wasn't approved until 2006 for females and 2009 for males. Before it was approved, it went through clinical trials of more than 26,000 male and female participants. At the time, that first vaccine protected against 4 of those main high-risk types of HPV that are known to cause precancers, and then that could eventually lead to cancer. And then they were able to provide protection for an additional 5 through a new vaccine that was released and approved for use in 2014. And again, that vaccine also had to go through clinical trials, and it was tested in more than 15,000 male and female participants to ensure that the vaccine was both safe and effective. So the vaccines for HPV protect against the primary causes, the primary types of HPV that cause precancers. And then in the United States, the vaccines that we have available also protect against the types of HPV that cause genital warts. And sorry.
Yeah, so it's amazing how well this works. In Australia, where they've done this widely, cervical cancer is becoming rare. So they're saying that some new providers may never see somebody with cervical cancer. And I've had so many people in my life who've been affected by either abnormal pap smears that they have to keep going back for, or by cervical cancer. The idea that we could get rid of this is just so very exciting. So tell us what you're doing to help us increase our level of HPV vaccination among young people.
Yes, so we have a grant from the OHSU Knight Community Cancer Institute, and we're also partnering with the state's PE46 program, which is the Community Participation and Assurance of Access to Reproductive Health Services, to look at HPV vaccination rates among Douglas County adolescents. And the most complete set of data that we have is from 2020. And we looked at the vaccination rates of Douglas County adolescents. And we found that the 11 to 12-year-olds, who are the first group that are really recommended to get this vaccine, only 40% had started their vaccine series, and only 21% had completed that series. So the HPV vaccines are offered in either a 2-dose or 3-dose series, depending on how old you are when you start the series. When we looked at the next age group of 13 to 17-year-olds, only 57% in 2020 had started their series, and only 37% had completed it. Worldwide, the goal is to get 80% of adolescents to complete their vaccine series. So you can see that Douglas County has some growth that we need to do. So with this grant that we received, we're looking at talking to this target population group of 11 to 19-year-olds and trying to get a snapshot of their behaviors, their attitudes and beliefs around human papillomavirus itself, as well as the vaccine, and if there are any barriers or challenges that they're facing in initiating or completing that series. So that was kind of part one of our 3-part proposal to address this, because we also talked with their parents or their guardians and asked them similar questions about what do they know about HPV and HPV vaccines. Have they decided to have their child vaccinated? Why and why not? And then we also talked to providers, so pediatricians and family practice physicians within our county, because they see these patients. They're the ones that are offering the vaccines. And we wanted to get a sense for what they're hearing when they talk to patients and to their parents about HPV vaccines and any things that they're noticing as well. We hope to kind of take all this data and this feedback to identify any key trends and commonalities within these 3 groups, and see if there are any perhaps gaps in knowledge that we can address, or any barriers or challenges that people are facing that hopefully we can help them overcome, and so they can become vaccinated. And overall, we want to increase just the awareness and knowledge of human papillomavirus and the vaccine to hopefully increase their vaccination rates. And by doing so, we can decrease the incidence of HPV-related cancers in Douglas County and improve overall health outcomes for our county's adolescents.
Oh, that's great. There's been, so Yeah, I'm a pediatrician, so I offer this to lots of people. And a lot of people say, oh, no, I've seen stuff on the internet that it's either not safe or not effective or there's something wrong with it. And this goes back to some political people in 2012 and 2016 who made some totally erroneous statements about HPV vaccine. But really, it's the worry about that really has stuck. So we're really hoping that your work can get us past that and we can bring this up. I would love to end my career by saying that after, at the beginning of my career, cervical cancers were common. And by the end of my career, cervical cancers were rare. So that's what I love to see. So Kristen, tell us what else you do. You do so many things, but tell us what else you're doing in terms of assuring reproductive health services.
So with PE46, the program element 46, we're looking at making sure that people have access to reproductive health services. And so we work with Aviva, who we contract to provide those reproductive health services for our county, to make sure that you can get to see a reproductive health provider, to have conversations about your reproductive life plan, what your goals are in terms of reproductive health, whether or not you want to have children and when you might want to have them.
Great. Well, that's such wonderful work we do. So public health for the last few years has been really consumed with COVID. But even during this time when we've been working really hard on COVID, other people have been working on COVID, but also working on these other great projects. So think about a life where we could say, yeah, grandma had cervical cancer, and kids would say, what's cervical cancer? I've never even heard of that. That's where we want to go. We want to get rid of these diseases. Certainly when I started in pediatrics, H-flu meningitis was a huge concern. And now that's pretty much gone. We just don't see any more cases of that, all because of stuff that we do through preventive medicine and through public health. So Kristen, thank you so much for everything you do. You're great. And we'll be doing this every week. We have hundreds of great snippets like this for us to talk about in the next few weeks and coming months. Again, this is Dr. Bob Dannenhoffer, the Public Health Officer for Douglas County. Thank you for joining us for COVID Conversations and more.